How can providers differentiate between allergies, flu, and COVID-19?
Flu and COVID-19 present similarly since they're both viral illnesses that can cause respiratory symptoms. But although flu and COVID are similar, when you compare the two to environmental allergies, there are distinguishing factors. And the CDC recently published a Venn diagram to help, identify some of those overlapping and distinguishing factors. For example, when you're talking about environmental allergies, fever is not associated with environmental allergies. So allergies alone wouldn't cause fever. And other distinguishing factors include muscle aches, body aches, vomiting, diarrhea, and then there's, this sort of newer symptom, a new loss of taste and smell, which, people with COVID have described, and it's been described in studies as sort of new in onset, acute in onset. And you can see some of that with allergies, but it's usually gradual and due to a person's chronic allergies. And so I think that those are distinguishing factors when you look at sort of flu and COVID from a viral perspective. And then when you look at, when we look at distinguishing factors unique to environmental allergies, that's itchy, watery eyes. You should not see that with those viral illnesses. Sneezing doesn't appear to happen as much in COVID, but definitely happens in environmental allergies. Uh, and so those are the classic symptoms. And of course, there are many symptoms that overlap: the fever, the headache, the sore throat, the cough, the shortness of breath. So it's really important to focus on those distinguishing factors that I mentioned.